Hello and welcome to our interview. Today we are speaking with Dr. Rashna Dass Hazarika ma'am. She is the superintendent of our newly added healthcare facility PIMC, PA Sangma Medical College and Hospital. Ma'am, today we will be speaking about PA Sangma International Medical College and Hospital because this is one of the greatest value-added services to the healthcare, and this will help a lot of people and a lot of students also in the Northeast basically. So, ma'am, how is the PIMC now? Right now, how it is working. What are the services and how it will help the people of Northeast?
Okay, so there are two aspects to PIMC right now. One is that we have made the facility to hopefully welcome MBBS students in this year if we get the approval from the National Medical Council, for which the process of inspection is already over and we are awaiting their approval letter. So if we get the permission, then we will be able to take around 150 students or so, whatever they allow us, and that will be the beginning of something which is unique in the Northeast, because then it will become the first private medical college in this area. Of course, we have one in Sikkim, but if you consider the Seven Sisters, this is going to be the first of its kind, and the first private medical college in Meghalaya also. The second part is that we have started making the hospital services available. So in our current facility, we have more than 500 beds where we are already admitting patients for the last so many months, and we have given service to poor patients. A lot of surgeries have been done. Deliveries are going on a daily, literally every day we are having 1 or 2 deliveries, and our OPD services are on every day, 6 days a week, where we have a variety of departments like medicine, surgery, pediatrics, gynae, eye, ENT, so these, and also orthopedics. So all of these departments are giving their services daily in the OPD to the patients who are coming to us. We also have a very good investigative facility, the central lab or the laboratory facility, where 3 departments are integrated, that is biochemistry, pathology and microbiology. So most of the tests which are available elsewhere in the neighboring state as well as in the state of Meghalaya are being done here and at very concessional rates. We also have dedicated ultrasound machines, high-end ultrasound machines, and our CT scan is getting installed. In the pipeline are also the facilities for GI endoscopy, and we already have an echo machine, so we are doing echocardiography as well as ECG for our OPD as well as inpatients. So currently these are some of the facilities which are available, and they're available at very reasonable rates.
Ma'am, there is always a mentality of people of this area that whenever there is a health emergency, people always try to visit the other parts of the country. So, ma'am, our PIMC will meet the ends of that people, those who want to, take the facilities outside India.
India or outside Northeast?
Outside Northeast.
Yeah. So yes, that is very true. Majority of our people are of the feeling, they have I wouldn't say a myth, but they have a feeling that if you go outside to maybe Chennai or Vellore or even Bangalore or Hyderabad, they will get some facilities which are not available here. Now I don't blame them, because we do not have all the high-end facilities here, still not there in many of the hospitals. So PIMC in the long run is planning to have 300 plus super speciality component to its main hospital, which is by the way under construction, and in that we will have most of the facilities. So like say for example the renal transplant or the urology transplant center, which will be is headed by our Pro VC Dr. Sarveshwar Saharia, who is a renowned name in the field of urological surgeries and transplant. So that way we will be having the Mother and Child Center with all up-to-date facilities. Then we will also be having centers for gastrosurgery, for cancer, both radiation as well as surgery as well as medical therapy. So I think if we have all of these facilities under one roof and at very reasonable rates, then many of our patients will be convinced not to go outside the region for such kind of services, because going outside means you are also having a lot of travel expenses, expenses staying in the region where you have gone to, and that usually they will not think about it first. But once they go, I have a lot of my patients who come back and say that more than the treatment, they had to spend a lot of money in the staying and the food and the travel. So I think all that will be taken care of. That will be minus from the final bills of the patient if we give them the facility and they're able to come here, or they trust us enough to come here and get the treatment. So I think it's going to be a great journey. We are just few baby steps we have taken into it. Infrastructure development takes a long time. So infrastructure, equipment, once they're installed, then I think in the next 1 year or so, we should be able to provide many of these services from PIMC.
At the time of admissions of the medical courses, there's always a rush, and students always have to wait for they used to go to GMCH, but whenever there is no seats, then many students, they go outside. So this medical college, when we will get the approval, do you think this will help our students from Northeast? How to which level it will help our students?
Oh, definitely. I mean, no parent wants to send their kid too far off from home. So if we and hopefully we get the permission, then it will be a boon for the students of this region, because they're anyway going and spending a lot of money outside. So why not spend it nearby, and with the parents being very close. Now again, the question of extra expenditure comes in. Suppose some of my colleagues have their children studying in Chennai and Bangalore and all these places, and they have to frequently visit them.
Yes.
So that is an extra expenditure. Some of them have even taken flats, I've heard, to help their children. So again, that is an extra investment, which you won't have to do here.
Yes.
And as far as medical education is concerned, we are governed by the rules of the National Medical Council. So the education will be at par if we are having to follow, because we will have to follow those norms. They're very strict, and accordingly our first year labs, and the practical labs and the lecture theatres and all are have been made according to the NMC norms. So I think as far as that is concerned, the education level won't be any different from what is offered in the rest of the country, because this is a what should I say? I think this is a kind of protocol or a well-established norm which is followed universally throughout India. So we will follow the same. So I think the education will not be different. And as far as the economics part of it is concerned, which is of course a big thing for parents, if they are able to give the same education here without doing the extra added travel and stay and all the other expenses, then why not? I'm sure many of them are already willing. In fact, we are getting many calls.
Even us.
Yeah, we are getting many calls that...
Actually, many are waiting for this to come out.
Yes.
And also, I'm just adding this, there have been a lot of parents, even some of my friends, they used to go to foreign countries to study medical, like Ukraine and Bangladesh, and there have been so many emergencies. So last time, so if PIMC comes up, then it will be a help for a lot of people in Northeast now.
Yes. I mean, see, once you go outside India to study, the education level is fine, but once you come back, you have to give a foreign medical graduate exam. So that is an additional exam for the students.
Okay.
And you need to pass that. But if you're studying in the country, then that is also done away with. Okay. So I think we'll have many of these staying back. And I really fervently hope that we get our permission. Good news very soon.
Yes, ma'am. So ma'am, again coming back to our hospital services, which are the best parts our hospital have now, so that people will come to PIMC, this is the best part of PIMC and we need to visit PIMC, because we already have our kidney specialist Sir Bishar Saharia, Sir Padmashri, and we also have many doctors who are specialists.
So the best part now is that with facilities which are at par with the nursing homes which are there in Guwahati or the nearby places, we are offering the same services at very discounted rates. Yes. So you will get the same kind of facility, but with maybe 50% of the cost. We have very good surgeons, we have a very good medical team, we have a very good pediatric backup. So I think if people come, believe us, they can come and see, and they'll know. Already we have done more than 100 surgeries in the last 2 months. So that itself speaks of the kind of service that we are giving. Many of our patients have received at services at very discounted rates because of their poor economic condition. And we hope to carry on this good work in the future also.
And we also see that our hospital is helping a lot the poor people. The nearby villages. Our hospital used to go and conduct health camps for the poor people also. So ma'am, how is that maintained?
See, the best part of being a medical, being prepared to become a medical college is that we have already tied up with the government of Meghalaya, and we have adopted the Barnihat PHC as well as the Nongpo Civil Hospital as our community health outreach centers. So already we are sending our doctors there. Before they used to go twice a week, but now since this week we have started sending them every day. Like for instance, today one doctor has gone to Nongpo, and another one has gone to Barnihat PHC to help, because these places have a lot of patients and the doctors are less. So we are helping the government of Meghalaya by sending our own doctors, and we are also getting our nurses trained by them. And we have also recently discussed and decided to send our obstetrics team, the gynecology and obstetrics team, on every Friday to Barnihat PHC, because it seems that is the day when maximum of the mothers come for a checkup. And I have been in discussion with the Nongpo Civil Hospital authorities for sending our obstetricians on every 9th of the month, because that is the day when they have the Pradhan Mantri Matri Suraksha, I think, program. I don't remember the exact terminology. So the mothers come there on the 9th. All mothers are come for an antenatal checkup on the 9th of every month. So our HOD of obstetrics and gynecology has submitted a roster for our doctors to go there and help them. If needed, we will also help by doing an ultrasound of these mothers, because nowadays in the antenatal care, that means before delivery care, one ultrasound has been made mandatory as per the Government of India directives. So in case somebody is not able to do there, then we can easily offer the services here, because we have at least 3 radiologists round the clock, at least up to 5 p.m.
Okay.
Yeah.
So ma'am, our Chancellor sir, Mr. Mahbubul Haq sir, so he have a very high hopes to help people with healthcare facilities to the poor people, ma'am. What are your views on it?
No, I think that's very unique, and it's really nice of him to have that in mind, because see, the main problem with our country is that nobody invests in healthcare.
Yes.
I mean, if in a general room of 100 people, if I ask how many of you have health insurance, there will hardly be 20 people.
Yes,
80 people will still not, 80% of the population are still not covered by health insurance.
Yes.
So it's a very sad affair. Though the government is trying with the various schemes, but still many people are still not aware of the schemes.
Yes.
And there is a migrant population, there is a moving population which do not avail of these facilities. So I think we can help them out in this aspect. In fact, we are already in the process of getting the tie-up for the Meghalaya health insurance schemes. So if that happens, it will be another added benefit for the poor of the state of Meghalaya who can come here, because they have a smart card which they don't have to pay anything. So if we are enrolled with, if our institute is tied up with the government of Meghalaya for this, then it will be maximum benefit for the patients of the state.
And so, ma'am, in this very short span of time, we have already done a lot of things. And as a part of PIMC, even we are very proud. So, ma'am, what are the future plans? What are the future, how will PIMC growing, and what are the future plans?
So the first thing is we hope to get the students as soon as possible. And second is we are already construction work of the main building is fully on, and you can see a lot of changes have happened in the last 2 months. So as far as the Honorable Chancellor's version, he is hoping to have some of the outpatient services transferred to the main building by October of this year. That is number 2. And once the main hospital starts off, whatever we have talked of now, the high-end services will be slowly added. And then we are also delving into the research and other courses related to the medical field. For example, BSc nursing courses, the courses for the nurses rather. Then there are many other things which we have thought. We already have a pharmacy college, so that's already a value-added thing, which is already education thing, which is already existing in the campus. We also have a physiotherapy department, which actually will, be very useful for us. And the other courses like the diploma courses, the PhD courses related to health sciences. If people have seen, the advertisement has already gone out. So slowly we will start with all this. We already have a director of research, Dr. Jogesh Sharma, who is with us, and he's looking after all this. And we have the potential to do very good research in this region because we are totally virgin as far as research in health science is concerned. So we have lots of varieties of patients, varieties of diseases, some diseases very unique to the region. So I think as far as health research is concerned, we will be able to do a lot of contribution in this field.
Okay. Thank you, ma'am. Thank you so much for your time. We had a lot of information regarding our PIMC and our upcoming medical college also. We hope this interview will help a lot of students as well as the people of Northeast. Thank you.
Thank you.